We are so excited about the relaxation from the Department of Public Health and our Governor Ivey's office about our businesses and first team responders. And we're so glad to have our friends from Luma Dentistry here this morning. And of course, Dr. Dean, no stranger to you. We're glad to have her with us this morning. Also, Skylar Graham, the Business Development Director for Luma Dentistry. And good morning to both of you.
Good morning, Jimmy Dale.
It seemed like forever since we talked, and I know we were able to open up on Monday or so. Tell us, first of all, Scott, let me start with you. And none of us have ever walked this road before, so how has it been for Luma Dentistry?
Right. Well, thanks for having me. So it's kind of uncharted waters that we've been in, but it's been very smooth. Luckily, Luma Dentistry has been very blessed with a strong leadership team who has kind of taken action from day one, and we've kind of been proactive on trying to get ahead of the line curve, so to speak. We've had to do a lot of firsts. I think this was the first time that we've ever had to furlough some
and that's
team
not
members.
a word any of us like to hear.
Never. So we've actually been, we've kind of termed it play on words with COVID-19 and vacation. We've been calling it the COVID-cation. So furlough is a kind of a harsh word. So their COVID-cation, that was a first. But we've had to put a lot of extra precautionary steps in place. Some that have always been there, we've just heightened it. And then others that are fairly new, like an acrylic barrier in between two people, is kind of it's not something that most people want to talk and communicate through. So that's a first. But yeah, it's been pretty good.
Dr. Dean, first for you as well.
Yes, it is a first for me as well. Luckily, our team has been well trained in infection control, so we have a strong knowledge in that already. But like Skylar said, we're just taking extra measures that we did not before. Now, instead of when I walk into a patient room, instead of them seeing my face, unfortunately, I'll have my face covered, my hair covered, basically head to toe. But, it's still me. We're all still the same people. And most patients have dealt with it pretty well and have enjoyed coming to see us.
Luma Dentistry with 6 locations in central Alabama have always, since I've known about you guys, have been health conscious. You've always tried to adhere and strive to all the guidelines that have been handed down, and they're even more stringent today.
Yes, that's correct.
Yeah, absolutely. We've always practiced our standard precautions and universal precautions with all of our patients. I think the difference now is that patients are more aware of the heightened precautionary steps to their health. I think if anything, if it's brought anything good to this, especially the healthcare field, it's that people are more aware and more conscious and subconscious of following those standard precautions.
When, Skylar, did you begin to first hear that, hey, this might be an issue? Not December, I had no thought of it, but
Right.
As we get into the first of the year, when did you guys begin to get news of this?
So for me personally, and my team can vouch for this, I was kind of the front runner on getting a little nervous with it at first. But the more and more I started learning about it, the more my nervousness kind of washed away as I knew the steps that we were taking. There's not that much science available right now for COVID-19. So we're still kind of in those uncharted waters.
Yeah.
We're able to navigate the minds a little bit better.
Yeah.
So we still got a lot of learning to do, and I think as that science reveals itself, we will start feeling more comfortable, and maybe some of the restrictions that we have will continue to lax a little bit.
Dr. Dean, how have the patients of Luma Dentistry been affected by this as well?
Well, for the most part, I feel like our patients have taken this very, very well. People are still coming in, they see the precautions we're taking, and they feel very comfortable. We've taken every step, every measure to make sure that their appointments are safe and that they are still comfortable as well. So
Right.
we've received it
So you started contacting maybe people who had appointments back in March or April. You begin to contact them and kind of get them reset to come in?
Yes, we're trying to get all of our patients back on their regular hygiene schedule and seeing emergencies. We were seeing emergencies during COVID. We were still seeing patients, but now we're starting to get all of our patients back on track, thankfully.
Walk us through, and I've been a patient of Luma Dentistry for some time now. It's different. It's the what they're calling the new norm.
Right.
Walk us through what a patient might expect when they come on the grounds of Luma Dentistry.
Sure. Can we take that? Okay. So some of the new things that we have is that we are able now to open our waiting rooms, but with certain restrictions. We still got to maintain social distancing. And so even though we have 6 locations, not all of them are set up the same. They're more like sister locations, not twins or triplets. So we have to take it on a location by location basis. But for now, when patients arrive, we ask that they stay in their vehicle. They give their location, that phone number a call. And we have one of our team members who are well trained in the screening process come out to their vehicle, almost like Chick-fil-A, and do curbside check-in. We go through a couple of screening questions. We take your temperature, and then once we're done with that, we notify our people in the front. They check the patient in, and then when the clinical team, like Dr. Dean, is ready for them, we go right back out to their vehicle and let them know, and they come straight in. So they bypass the reception area altogether. But there are some caveats to that. We still, if they absolutely need to use the waiting room, we have that available to them. Assuming that there's, social distancing
That's the key there.
Yes. So we still want to follow, we actually are following all the CDC guidelines. We're following all of the ADA recommendations, the Board of Dental Examiners, all of their opinions and advisements. And then we've kind of put a lot of our own kind of precautionary measures in there as well. So everything else, though, is still the same.
Pretty much.
The only difference is instead of seeing her smiling face, you'll see her eyes smile instead of her mouth.
Yes.
But we're completely wrapped up to head to toe. We advise patients that a facial covering of some sort, whether it's homemade or store-bought, is the way to go. Walking to and from your vehicle, as well as wearing it inside the dental office. Of course, you got to take it off when you get your treatment done. But we are still very, very much aware that COVID-19 is a thing still, and it's still affecting people. And we're doing everything we can to kind of continue to flatten that curve. So.
Dr. Dean, I would just guess in knowing how that you guys would be dressed when I come in for dental treatment, I guess our personalities really have to adjust and come alive more during that time.
Yes, absolutely. And we've been really great, and our patients are just so understanding. They know that we're protecting ourselves as well as them when we're dressed from head to toe. And so, our personalities do have to come out a little bit more without them seeing our facial expressions or anything, but it's been really fun. It's been great.
A lot of adjustments taking place, a lot of improvements taking place, and I know you guys are excited to welcome your family back to Sylacauga and the other locations as well.
Oh, absolutely. I mean, that furlough, that bad term, we had to do that for, we have 100 and plus team members, and so it was really hard having to, tell them that, hey, we don't have anything for you guys to do in the next coming weeks. So, take a voluntold vacation kind of thing. But we stayed in communication with a lot of our teams. So that's one good thing. Even though we have that many team members, which we're blessed to have that many, we have a lot of communication sources in place, like Microsoft Teams, that we were able to communicate with constantly, have video face chatting. So all of us, including our doctors, our leadership team, everyone stayed in constant communication. So it's kind of like we had a family reunion when we came back on May 4th, but through social media and other communication networks, we were able to stay connected. So that was nice.
And it was a nice break for me, but I actually enjoyed the fact that, or it made me feel better that my patients were still taken care of because we were still open for emergencies, even though Sylacauga location was closed, McCalla was still open. So although I hated being off of work, it was a nice break, and my patients were still taken care of. So.
And during that time, we always tried to accommodate all of our patients and their needs. And it was very hard even during that time because we were under strict guidelines on what an emergency was. So there was a lot of times where, I've been in dentistry for 20 years, and it was very disconcerting to have to tell patients I'm sorry, we can't see you. So those restrictions kind of, they definitely restricted us on how we could treat patients. But I'm truly glad that we have been able to get back to our new normal, as you say, so that we can start treating patients fully again.
So what about, I know it's put you in a tough spot to even ask this question, but I'll ask it because our viewership, they don't know.
Right.
I don't know, and you probably don't know. How far is this going to go along, and how long do you think we're going to be in this kind of circle?
Yeah. Well, again, the science isn't truly there, but from what we've heard, and we stay pretty current on all the information. It's from the health departments and from the people that are smarter than any of us in this room. It's supposed to kind of heighten back up towards the end of the year, the fall season. So I'm hoping that all dental offices, all healthcare fields are taking the precautionary steps now. I know some of us in the dental field, if we didn't take those steps a couple of weeks ago, they weren't able to open this past week. So I'm hoping that we kind of jump ahead of it and learn from our mistake of not jumping ahead of it sooner, and we're all able to stay ahead of that curve again. Hopefully it'll die down, but
hopefully
we'll see.
Yeah. Skylar Gray, I'm the Business Development Director at Luma Dentistry, and Dr. Kim Dean, who is our dentist here in Sylacauga. We're so glad to have them in our city, and we appreciate them. And you that are watching this morning that have been patients, or maybe you want to become a patient, here's a couple of things that you need to know as we navigate this new normal. What are some key things, let's talk about this again before we go, some key things that the patient must know as they prepare to come to receive dental work?
All right. Okay. So a couple things they must know is, I guess the screening questions would be a good thing. If you've come in contact with COVID-19, someone with COVID-19 in the last 14 days, I think 14 days is the key. Or if you've been tested and tested positive within the last 14 days, we're going to politely advise you to get back in your car and turn around and go home, or go seek medical attention.
And it's not a personal
thing.
No,
it's not. It's definitely a precaution. We're trying to protect you as well as others, and as well as our team. The other thing would be if you've had any kind of flu-like symptoms, or if you felt feverish or ran a fever in the last 14 days. Your body's telling you something, and so it's our job to tell you to go home and take care of what your body's telling you. And then if you've recently developed a persistent cough or some kind of respiratory issue, that's something that we would want to turn you back to your healthcare facility for. And then of course we're taking your temperature. If you reach 100 degrees, we're iffy at that point, and we want you to seek medical attention. So luckily we as healthcare professionals know that there is a direct correlation between your dental health and your overall body health, and so even preventive care is important. So we still are encouraging you to come see your dentist because it's a necessity for your overall health.
Dr. Dean, certainly we want to remind people that your dental health is so important, and even though we've been gone a couple of months, we need to get back on track and make sure our dental hygiene is taken care of, and our dental needs are taken care of.
Absolutely.
Yes, absolutely. Everything is connected, so we want to make sure that your dental health is in top shape, so then the rest of your body can be also healthy. Right. So we really want to get you in there, get you taken care of.
A couple of services that you offer here for people who may have forgotten.
Yes, we offer all aspects of dentistry. We offer preventative care, hygiene, basic restorations, extractions, dentures, all of the above.
And ladies and gentlemen, they specialize in nervous people like me. I'm living proof of it. Thank you so much for coming this
Well, thank
morning.
you, Jimmy
It's
Dale.
been a pleasure. And Dr. Dean, if they want to make an appointment, can they call this morning?
Yes, please call us. Our number at the Sylacauga office is 256-245-5635. If you have any questions, please visit our website. It's www.lumadentistry.com.
And I got to throw this in. If they don't have health insurance, there's a plan there that can possibly help them as well.
Absolutely.
Yes, we offer the Luma Dentistry plan, and it's a yearly fee for $300, and it covers 2 healthy cleanings, your routine x-rays, your routine exams, and 20% off all other procedures. So.
We're smiling out loud this morning with Skylar Graham and Dr. Kim Dean from Luma Dentistry. Thank you so much for being here this morning.
Thank you, Jimmy Dale.
More day break right after this.